Okay. Welcome to Restarting and Energizing PFACs and easy to implement how-to lists. We are on about the seventh of our series, sixth or seventh of our series. And today we're going to be talking about recruiting internal partners for your PFACs. We always ask a colleague to help us with presenting this information and share their personal experience with PFACs and how they have done it. And today we're excited to welcome Marcy Romero, who is a nurse by training and is a PFAC cheerleader of late as the manager of patient and family relations at the University of New Mexico Hospitals. I am Lisa Maurice. I'm the Executive Director of Consumer Advancing Patient Safety. We are co-presenting this with H2PI. And my screen, there we go. Today, we're going to talk about the definitions of recruitment, defining what an internal partner is, why we have internal partners, levels of internal partner participation, factors to consider in selecting them, how to find them in the first place, and some extra special considerations around internal partners. The first thing is recruitment, which is the process of basically finding people, right? And hiring candidates for a specific job when you're talking about a job. This is not exactly like a job. It's more a volunteer position, but it's the process of adding new individuals to a population or subpopulation, in this case, your PFAC. And in this case, we are talking about internal partners who are persons who receive compensation for work performed at your facility, or sometimes board members who are not receiving compensation, but they are affiliated with your facility in a professional category, not as patients and family members. And they really represent stakeholders at all levels. Right, Marcy?
Absolutely. You said it fantastic. And I know we have a lot of information to cover, so I'm going to jump right in. As Lisa stated, I'm the manager of the Patient Family Advisory Committee at the University of New Mexico Hospital, and you'll hear me refer to that frequently as PFAC. So the term internal partner, that is a term that is, as Lisa said, really defines the staff, stakeholders, which can include providers, leaders, administrators. You know, I like to say stakeholders at every single touch point of care. So at every level of care that the patient goes through, where a medical error can occur or where there's an opportunity for patient engagement, we want to have staff from all levels participating in our PFAC. Next slide, please. Thank you. Fantastic. And so why include internal partners? And I think that is a very important question and something that I've really learned a great deal about over the past year. So number one reason to include internal partners is to build relationships. When you build relationships, you're cultivating trust. And it's so important to cultivate trust when you're trying to make improvement within a hospital, because PFACs a lot of times are new to a system, a health system or a hospital, and you have to build those relationships first, and then you can build the trust. So I worked with H2PI, or organization, in building our PFAC, and one of the things that Armando really emphasized to myself was to explain the why to the internal partners and to really get out in front of the public, our staff, as much as I could, talking about PFAC. So with intention, I participated in many meetings. One of the first wins that we had was, if your hospital has grand rounds, if they're a teaching hospital, I recommend that you present on PFAC at that. It's a great way to really involve providers and to pique their interest. Another reason to include internal partners would be to honor the partnership that's really involved in including the voice of the patient. You know, healthcare providers all of us, I believe, go into medicine wanting to help someone. And this really gives them an opportunity to do so. Speaking for myself, going into nursing, a lot of times I felt that I was spending a lot of time charting behind the computer, checking off boxes, and I really missed engaging with the patients. This is a great reminder to our internal partners that that indeed can be done when providing patient care. I would also say that when you engage your patients during meetings, it's more likely to translate into practice. And so again, our internal partners leave these meetings excited, rejuvenated, and they want to communicate more with their patients. And then lastly, when you involve decision makers, you're more likely to implement meaningful and lasting changes. Next slide, please. Or actually, I want to talk about one more thing. Sorry, Lisa. At this last bullet point, developing to make the emphasis on quality and safety. And so you'll notice safe, timely, effective, equitable, and patient-centered. Those are the 6 dimensions of quality care, safe quality care. And so if you make sure that your internal partners understand that that's what you're trying to do, you'll all be on the same page. And thank you, Lisa. Next page. Next slide. All right. So it's important to build a diverse PFAC and to include internal partners from, as I stated earlier, all touch points of care. And this is really defined by regular members. And then a little bit later, we're going to talk about ad hoc members, which might be a term that you've not heard. So I'll define that in a bit. But a regular member, internal partner. So again, we're going to define their role, their relationship within the charter or within your bylaws, whichever you have. But make it known that they're really expected to attend the meetings and to be actively involved with the spirit of volunteerism. And I want to emphasize that. At UNMH, we focus on, and personally, I believe in servant leadership. And I think that if you ask internal partners if they're interested in serving on your PFAC, that sets the tone from the very beginning. It lets them know that this is an act of service that we're doing for our patients. And then you're ensuring that they have this spirit of volunteerism. Something to consider is actually including your advisors in interviewing those internal partners. I promise you, once they've become involved in PFAC, they will be able to determine the why of an internal partner from the get-go. And after those interviews or discussions, as I like to call them, a lot of times you can tell right away if that relationship is going to work or be effective. Also, earlier I mentioned making sure that you have a diverse PFAC with internal partners from all levels. That includes C-suite members. So chiefs, your chief executive officer, have them come present if you can, or even better yet, include them on your PFAC, maybe the chief medical director. We have a chief quality and safety officer that serves. We also have a board of trustee member that is not only an advisor, but they also serve on the board of trustees. So they kind of have that dual role. We have hospitalists, we have members from environmental services, extremely, extremely important. Food services, another department that I was surprised at how much we've interacted with them. You might hear my cat in the background. She's excited about this discussion as well and does participate in our PFAC meetings. And then of course you want to include staff, ancillary staff. So those that take part in the registration process, or maybe staff from the appointment center, levels that you may not consider from the get-go, security, parking. Something that I did was I actually asked our PFAs, who would you like me to recruit? What departments are you interested in learning more about? So don't be afraid to ask them for suggestions. Next slide. All right. And so it becomes important as you really lay out your roadmap to determine the ad hoc members that you want to join your PFAC. And so by ad hoc, I mean as an ad needed basis. And a lot of times I've ended up determining my ad hoc members by those internal partners that really want to be engaged, really want to be involved, understand the why, but are just extremely busy, which so many of our internal partners are right now. So don't let it be a deterrent. If you have an internal partner or someone that's interested in joining your PFAC and they say, I'm just so busy, it's okay. You can join us at when you're comfortable. We'll reach out to you when we have a project that we think would interest you, and we ask that you do the same. If you hear of something, please reach out to us. Also, another benefit of having ad hoc members that are internal partners is that they can be cheerleaders for you. They're out in the hospital, in the health system, talking about PFAC, even if they're not attending every single meeting. It's important that you include them in all communications, send them the agendas, send them the meeting minutes, send them the annual reports, and also make sure that they complete all the requirements for becoming an actual internal partner, which we're going to touch on, I believe, maybe in the next slide. Go ahead on to the next slide. Thank you. All right. So we've talked about this a little bit, including PFAs in selecting internal partners. Absolutely. A lot of times we have our advisors participate, including in interviewing advisors. So why not have them participate in interviewing internal partners? We are partners in this effort to improve patient safety and to improve patient engagement. And so I believe that part of that is removing the nurse jacket, the white coat, taking the badge off and sitting down and having a discussion together and understanding that you have a lot of commonalities and really coming up with solutions together. If that can start in the interview process, then you're off to a really, really good start. Also, I think it's important, if you're PFAC, and I encourage you to get involved with quality and safety work. And if that's what your advisors want to do, make sure that you're including partners that are from those departments. So something that our PFAC is doing right now is we actually have 5 questions that we ask all internal partners that our PFAs, patient and family advisors, created. And they are focused on quality and safety. So how do you plan on utilizing PFAC in improving quality and safety throughout the hospital? It's not to put them on the spot. We send them the questions ahead of time. It's just to help them think about, is this really something that they want to do? And how are they going to ensure that we're successful? All right, next slide. And I'm going to touch a little bit more on the actual onboarding process. So again, spirit of volunteerism has to be evident, not only with our patient and family advisors, but our internal partners. Something that Armando taught me, who's here right now, is really finding that out in the interview process. And sometimes it takes time. Sometimes you can sense it right away. Other times you really have to ask fact-finding questions. So I again encourage you to work with your advisors on determining those. Also, make sure that your ad hoc partners and really all internal partners understand that patient care always comes first. So while we want them to be present at every meeting, as stated in the charter, something comes up. Right now I'm thinking about the pandemic, or PFAC formed during the pandemic. I encourage you to be flexible with your providers. We want them to be available to our patients. So we work with hospitalists. It's not unusual to get a call ahead of time saying, I have to see patients tonight. I'm not going to be able to make it. But also be flexible, make it convenient for your providers. I have a hospitalist that attends from the courtyard in his scrubs. He likes attending the meetings. We make him feel comfortable doing so. Again, we're forming that partnership and building collaboration. And I'll tell you what, the patients love it. They love seeing internal partners that are working, attending PFAC meetings. So he's like, I'm on break, but I really want to be here to hear what our patients have to say. That means a lot to them. And of course, emphasize, why do you want to serve on PFAC? Also, onboarding for our internal partners. This is something that we've worked very, very hard on. We have all of our internal partners go through the same onboarding process that our advisors go through. And we'll talk about that a little bit more on the next slide. All right, fantastic. So our internal partners go through the role of an internal partner. So first they go through HIPAA training, compliance training related to patient and family advisory work. Then they're trained to their role of being an internal partner. I lead that. Then we have our patient and family advisors train them on quality and safety basics. And the reason that we've decided to do this is because it engages our internal partners on the idea to working with patients in quality and safety improvements, because for a lot of them, this is a very new concept. And I just want to share with you quickly something that happened a couple of weeks ago. Our advisors, there were 12 of them present, presented quality and safety basics to roughly 30 internal partners. So internal partners, staff at all touch points of care, and they taught quality and safety, and they incorporated lived experience into that. Our internal partners were in tears by the end of the conversation because it resonated with them. They were able to put a story to the terms. It was more than an error of omission or an error of commission, an adverse event. There was a face put to the story, and it meant something, so much so that we're now being asked to present this training across the hospital to internal partners. So it truly can be done. And I'm happy to help in any way that I can with your PFACs. If you have further questions, if there was something that I didn't touch on, in this discussion today, we'll give you my information and you can absolutely reach out to me. Also, you have an amazing resource right here with Armando and Lisa, but Armando has really been one of my biggest and greatest mentors, and has taught me so much about what I know working with internal partners, even using the term internal partner itself. We planned on coming up with a different term and we never did. And we actually really like it now. So thank you, Lisa. And I'll open this up to questions.
Sure. Thanks so much, Marcy. I really like the term internal partners too, because it's we are used to saying providers and staff as if they're not equally important. And I think one of the things that's really important about having internal partners is that they are peers to patients and family members in this process, whether they're in the C-suite or they're from security. They're all on the same level as we talk about quality and safety and work out what is going to be best for your facility, your culture, your environment. And we had internal partners at the PFAC that I ran here at the Children's Hospital in Salt Lake City. We chose from a variety of backgrounds, and we had some major aha moments because we had these partners come in. And I'm just going to share one with you that's really fun. And I shared this with Marcy. We had a PFAC for our teen patient members, and because they indicated that amazingly one of the things that was most important to them was food, we invited our head dietitian, our head of food services, actually to come to our PFAC meetings. And she really got into the spirit of attending these youth advisory council meetings, bringing food for them to sample to each meeting. Should we serve this or should we serve that? But one of the things that happened is a young former oncology patient said that one of the worst things they experienced was when they brought the food into the room, when they brought the tray to the patient, they would lift the lid from the plate, that plastic lid with the little hole in the top. Lift that lid up and the smells would waft to the patient, and immediately they became extremely nauseous and lost their appetite. Because of that conversation, something so simple, those lids were lifted off so the gases could off gas outside of the patient's room, and it actually increased the patients being able to eat their meals.
Yeah,
And
absolutely.
that's the kind of thing that you can get through having a cooperative environment between internal partners, and in this case, teenagers on an advisory council. So
And the solution focused, you know, when you have the
Right.
people at the meeting, a lot of times you end up arriving to a solution within the meeting. You know, I love that example. We, at one of our earlier meetings, we had a presentation, we're building a new hospital tower. And one of the advisors discussed parking, ADA parking, and said, how many spots are there? And so they looked into it, and the advisors discussed this and said, that's not enough. They had a real-time answer during the meeting because this person had that information available to them. By the next meeting, we had 26 additional spots added. So the solution happened almost immediately. You know, the resolution, you didn't have to go up the chain of command, which is oftentimes so lengthy to get something accomplished, because the patient said it directly to the stakeholder.
That is so interesting, Marcy, because we had the same issue. And I wonder if there's some ratio for a commercial building that architects implement in allocating handicapped parking spaces that just flat out doesn't work for hospitals.
Right.
There's one thing that y'all can take to your PFACs and see if there's sufficient parking for individuals who need closer access.
Yeah.
We will be sending everybody who signed up for today's event the PDF of how-tos for recruiting internal partners. So you should be receiving that in the mail. Oh gosh, probably in the next half hour or so. And this is our contact information. Before I turn it over to Armando briefly, who has a question? And if you just want to unmute yourself and ask, that would be very helpful. Kathleen?
I have a comment.
Okay.
In the state of Massachusetts, where we're from, we are mandated by state law to have PFACs. Every hospital must have a PFAC. And in those laws, they restrict us in the percentage of internal partners. It can't be more than 50% of the group.
And nor should it be,
And
you know,
so
absolutely. Yeah, and sorry
we
to
do
interrupt.
ad hoc.
Yep.
That's okay.
No, absolutely.
We do the ad hoc method a lot. Yeah.
Yeah, you don't want too many internal partners. I think that's why it's so important to select the right ones, because it's so, you know, it's for the patients, right? And you want to have that balanced ratio, but it's a partnership and you can't come up with meaningful solutions without both. So yeah, Kathleen, don't let that be a deterrent. Absolutely use that ad hoc. And it sounds like you're doing exactly the right thing.
You know, the other thing you may find, there's a couple of factors that go into this. So another thing that you may find is that even if you have a third of your advisors who are internal advisors, they'll end up being half of the advisors at a meeting, because a lot of times the members of our PFACs cannot participate. Although with our new virtual opportunities, we can increase that participation level. Because many of ours at least couldn't participate because they had family members who were homebound. But having a smaller number of internal advisor PFAC members kind of means that the demand is higher than the ability to meet the demand. You'll end up, as the PFAC grows in popularity, which it generally does, with more people wanting to be internal advisors than you have room for. And that's where the ad hoc opportunity comes in, particularly if there's an initiative or another quality and engagement related topic that's going to be discussed, where they can come and present to your PFAC. And Nadine says, don't you think too many internal versus volunteer ratio might hamper free thinking? Yeah, that is a challenge. That's why you want the balance to be on the side of the volunteers versus the internal partners. Also, it's important to consider and train the volunteers, your patient and family advisors, to respect the information that the internal partners are bringing, because while we as patients and family members may have a concept of what the hospital or the ambulatory facility could do differently, the internal advisors may be able to share why a certain policy and practice is in place, and between the two work out that maybe it's a good idea that things are being done that way, or maybe it could be tweaked slightly. But to get their input is so important, because sometimes there are things that patients don't always get right away.
Oh, it's a great way to get educated, of course, and you only grow as a PFAC member. But on the flip side, you could have a clinician or an internal advisor, and we've always done it that way, and they can't think beyond the scope of clinical care.
And that's where training the internal advisors comes in, to listen to the patient and family members. So Nadine, very, very true. We need to get beyond that. In fact, I used to have a poster up that said something about the best thing to do was to try to think outside the box, and how important that is. I want to turn a few minutes over to our colleague Armando, who has been so instrumental in helping so many facilities put together patient and family advisory councils for quality and safety. And Armando, you have this wonderful new system that you're offering. Do you want to share just a few minutes about that?
Sure. Thank you very much, Lisa. First, before I get started, I want to say something that, Marcy keeps giving me kudos in our organization, H2PI, and how we mentored her. But the reality is that she's taken off gangbusters. So I get to learn from her now, everything she's doing. So Marcy, thank you for all your work. And Lisa, thank you for your work. So when we were setting up the PFAC at UNMH with Marcy, it was during the pandemic. We were supposed to do it in person, but then the pandemic broke out, so we couldn't do it. And so we didn't have this particular platform. We utilized Zoom, and we were very successful, but we learned something that wondering if there was a platform that we could use. We found a piece of software that's built on artificial intelligence, that we modified it completely and developed this new journey to build a PFAC from ground zero. And it's absolutely phenomenal. It's a great learning opportunity for the project team to develop their PFAC. It takes you step by step. It's engaging, it's interactive, and it's just amazing. I mean, I'd be more than glad to give you a demonstration if you ever wanted to see it live. But just recently, we developed, this is the full journey, which has 35 modules, and you get a certificate at the end. But we just developed a mini course now, because we realized that during the pandemic, a lot of the PFACs were put to the wayside, and rightfully so. There were other priorities there. And so a lot of organizations are saying, well, we're re-engaging our PFAC now. How do we do it? How do we bring them on board again? And how do we do it virtually? Because we still have to do stuff virtually. So we developed a mini course for that, just for that purpose. Lisa, obviously, if anyone is interested, please share a way to contact me, and I'll be more than glad to set up a demo on this. It's really, really great platform.
Right. And I have actually gone through many of the modules, and I learned new things. So we all can learn new things from the work that Armando Nahum and Marty Hatley have put together. And yes, please get in touch if you're interested in finding out more about what they bring to the table. Finally, I want to let you know, and I appreciate everybody's participation today. I appreciate the comments that have been made. I always appreciate seeing old friends and new friends that attend these meetings. They are available on our CAPS YouTube page. And we try to get those up relatively soon. Next month, our meeting will be talking about diversity and inclusion, not in your whole facility, but specifically on your PFAC, and making sure that you are representative of the patient population that you are serving. And there's ways to do that. Thank you all so much for your time, especially a big shout out to Marcy for taking the time to help put this event
Oh, no, thank
together
you.
and present on it. And we'll look forward to seeing you next month. Take care.
Sounds good. Fantastic. Thanks, guys. Bye-bye.